to having a conversation with you about healthcare. Sure, we had a big week this week talking about healthcare and hopefully moving forward to improve outcomes across the country. Of course, we have to work with the provinces on that, but I think there's I'll talk a little bit about that, I'm sure. But it's an opportunity for me to sit down with all of you and talk about your future and our future collectively as a country. I was thinking about it. You're ending a 2-year program this spring, which means you chose to step up and get into a nursing program in September of 2021 after that first crazy difficult year of COVID, and when we saw just how much our frontline health workers were standing up, but also we were seeing all the challenges in our healthcare system, all the gaps. And each of you decided that, you wanted to be part of serving and helping your fellow Canadians and building a better future for people. And that is incredibly inspiring, but it's something that we've seen flavors of right across the country as people have chosen to step up. It's one of the ways we got through the pandemic, of people leaning on people in really meaningful ways. But at the same time, we also know that there are a huge number of challenges out there, whether it's within the medical professions where people are burning out and the supports and the resources just aren't always there enough, or across the country where people are challenged with rise in inflation, rise in interest rates, rise in cost of living, at the same time as there's uncertainty about all the changes going on in the world. So one of the things that I'm really looking forward to hearing from all of you is how you're doing. What you see as the big challenges you're facing over the coming years, what you're seeing in your profession and your chosen profession, what your next steps are, but also what the federal government or governments in general can and should be doing to support you. Oui, on a fait des annonces énormes dans notre système de santé, pour notre système de santé plus tôt cette semaine, et on va faire des investissements en partenariat avec les provinces, mais il y a beaucoup d'autres choses à faire et j'ai bien hâte de vous entendre dans les 2 langues officielles, si vous voulez, sur ces enjeux-là. I know there's lots to talk about. I'm glad to be back here with Anita. She's your local MP. I was here at Algonquin just the year before becoming Prime Minister for a big town hall with students. That was a great opportunity for me to hear and learn from all of you, and I'm really looking forward to getting back into it today. So happy to talk about whatever it is you guys want to talk about. We can obviously, in this context, can talk a little bit about blood collection and anything related to healthcare, particularly the conversations we've been having with the provinces. But there's so much more going on, and you are not just your chosen profession. You are so much more. You're kids with parents who are getting older. Some of you may be parents yourselves, and looking at your kids' futures. You're going to be living and working across the province, maybe even across the country in various places. There's so much going on in the world right now that, for me, hearing from you on a range of things that are on your mind is what I learn most and what I appreciate best about these opportunities. So with that, does anyone have any questions or comments or things that they want to bring up with me? Yeah.
Thank you.
What's your name? And you can stay seated. You don't have to, or you can stand up if you want. It's really whatever makes you feel.
Okay, thank you very much, Mr. Prime Minister. So nice meeting you for the first time in person. So I have 3 questions.
Okay. First of all, what's your name?
Okay, my name is Shay.
Shay.
Yeah.
Pleasure to see you.
So my first question is this. What will you do to ensure appropriate and quality education in government school for our kids? Because I'm a mother and I'm speaking on behalf of mothers. And then the second question is, Mr. Prime Minister, sir, why can't we get free funding for this program? Especially now that we are going to school during the pandemic. Mm-hmm. And it's been difficult to support our families, especially some of us with kids and without jobs. So it would be so nice if you can look into that for us.
Mhm.
That's all so that we won't have to, get more debts, being debt. So that would be nice. And the last one is, can you please look into, getting an incentives or financial support while attending the consolidation program, because we'll soon be finishing. I was attending that for 2 months, and because of the high standard of living in Canada, we really need your support, sir. Thank you.
Okay, I heard a lot of positive reinforcement on that consolidation program. I'm going to have to ask a little bit about that. First of all, on quality public schools, that's hugely important in Canada. We know that quality public education is one of the things that has resulted in the tremendous success that Canada has and is over the past years. We are the best educated country in the OECD, which is a large grouping of developed and developing countries. We have a great public education system, and the federal government has certain intersections with it on funding, particularly around Indigenous, particularly around particular programs. But largely it's a provincial priority. The provinces right across the country from the creation of Canada got to deliver social services like public education or education in general, and delivering healthcare as well. So because Canada is such a big country with such diversity of perspectives and realities, and has always been, there are different needs and different priorities from one end of the country to the other. The federal government certainly is there to support, and we directly support in post-secondary education, make sure that the universities and colleges across Canada are properly funded and do well. But provinces are the ones who are ensuring the highest quality of public education. And every provincial election, public education is an important debate that has, and it'll be really important as you continue to want the best for your kids, to pay attention to what various provincial parties and politicians are saying about how they're going to support public education in this country. Because it's one of the things that has made us not just successful in terms of knowledge and education, it also is really good for people understanding instinctively what a strength in our community diversity is. When everyone goes to the same quality public schools, because nobody has to pay for them, and you have kids who are sons of bankers and daughters of lawyers, and sons of social workers and daughters of teachers. I mean, you get a range of people and experiences from all sorts of different backgrounds, and everyone gets to know each other, and everyone has the same quality education. That's one of the things that binds together a country. And when you look at countries where education systems are very much stratified in different socioeconomic levels, where if anyone has any money, you have to send your kids to a private school, you lose something of the social cohesion that is one of the great strengths of Canada. So, huge believer in public education. Even though I was a school teacher in the public system for years before becoming a politician, I don't get, as a federal politician, to have a huge say as a politician over public education. But I can tell you, I have kids who've been in public schools pretty much all their growing up experience, and it matters to me that there be quality public education. Second question was around tuition. Again, tuition is a thing that both the provinces and the federal government work together on. We, over the course of the past 7 years, put a lot of emphasis on supports and funding for post-secondary education and colleges. Over the course of the last couple of years, we increased by 50% the grants programs from the federal government to make sure that specifically low and middle income students could access education. We took off any interest payments on student loans for the pandemic, and we just recently decided, you know what, we're going to leave off interest payments for good on the pandemic. We brought in a measure that said you wouldn't have to start paying back any student loans until you're making $25,000 a year. We now just bumped that up to $40,000 a year. So you don't have to pay back your student loans until you're reaching a quality income threshold. We've dropped the proportion of your income that you have to pay at maximum pay in terms of student loans from 20% to 10%. You now only have to pay a maximum of 10% of your aggregate family income in your student loans when you're coming back. We've also got massive forgiveness programs. Depending on where you go work and how you go work, if you're working in rural or remote or underserved areas, you'll get massive credits on your student loans. So everything we're trying to do is around making sure that for someone like you, for anyone who is worried about, pretty much everyone, worried about how to pay their bills and not wanting to start your career and your family carrying a massive load of debt, and that worry may be keeping you from actually going to school to study, to develop your skills and take that career path. We're trying to remove that disincentive so that going into debt isn't the burden or the worry that will keep you from doing your studies the way you can. There are places in the world that have made the decision to offer free tuition. I think it's a good goal. I think one of the most important things for most Canadians is not that everyone has free tuition, because there are, families that don't need free tuition, that can fully pay for their tuition. The priority is making sure that people for whom there are financial barriers, where not having free tuition is a real barrier to them going into school, we have to take care of those people first. And that's where blanket free tuition maybe isn't the best allocation of funds, that focusing on making sure those who need help get all the help they can and they need, and those who don't need the help, well, that's great. You can make it through the program, based on having a family income or parents that can help support you. So our focus is really on making sure we're giving the opportunity to everyone to succeed, and if they're facing barriers, and sometimes they're financial barriers, sometimes they're other, respond to those barriers specifically rather than just blanket doing it for free. Now, tell me, what is the consolidation program? And I'll come to you next. Sorry.
I can tell you what consolidation
is. Sure.
So, but then I had a question as well.
Of course.
So consolidation is the part of our program where we are following a preceptor nurse who is like a full-time RPN. We basically work their shifts with them, but we're doing the work. So it's our time to kind of get a sense of what a full assignment for an RPN would be on that unit. And during that time, especially towards the end of it, the nurse you're paired with is totally hands-off, not helping you at all. So you are doing all of their work, but we get no compensation for it. Like we are still paying the college to do the consolidation.
So it's part of your education.
Yeah, part of the education.
But it's a very work-heavy part of your education.
You look at programs where there is apprenticeships, like with auto mechanics, a lot of the trades, there's compensation for the work they are doing when it is part of their learning. But for us, there's not really the same.
It also runs 4 weeks after the end of the semester, so you're getting if you get OSAP.
Okay.
You're getting it planned for 15 weeks. Their semester's 20 weeks long.
Okay, so there's that gap there.
Not only do they run out of money from OSAP, they now have to work while they're in placement to be able to pay to be in placement.
Well,
So
well, I mean, that sounds like there's a couple of things in there. First of all, it sounds like there's a pay equity issue in there. That they're offering this for more male-dominated industries like mechanics and other things and apprenticeships, but in I'm just looking at this classroom, where you, and that's the issue around pay equity, where it's not that for two people doing the exact same job, the man is paid as much as the women. That's basic, and that needs to happen. That mostly happens. There's still lots of work to do on that. But the big one is that certain jobs that are equivalent in terms of years of education, in terms of the professional skills and all those sorts of things, women-dominated sectors end up getting paid less and having less benefits and less of these issues resolved for them than more male-dominated areas. So it's a pay equity issue. But it's also an issue of recognizing the pressures you're under. I mean, if it's an obligatory part of your education pathway, it should be regarded as such and included in those sorts of things. Now, this will be a combination, probably a little heavier on a provincial issue to decide, but that's also part of why the focus that we've had in and that we're going to have in negotiating those healthcare accords with the provinces is going to be looking at things like this to make sure that we're properly supporting healthcare workers, properly incentivizing people to be able to do it, and not putting in these barriers that are going to have you already sort of stretched and stressed even before you start working in a field that we all know has a lot of pressures and stretches and stresses on it now. You've chosen to step up and go into nursing at this particular time. We should be making sure that we're supporting you in every possible way, and it sounds like that's a gap that that I should have our health minister talk about with his provincial counterparts when we move forward. But yeah, you had a question. What's your name?
Well, Olivia.
Olivia.
It was kind of going off of Shay's second question. I think we've seen personal support worker programs that have been funded probably by the province, not so much federally, but they have been funded so that students can attend those programs and work as personal support workers when they graduate, and they've paid no tuition. I think the question, I don't know if I'm assuming incorrectly or not, but for me,
specifically this program,
specifically nursing, when we're at such a critical period where we have senior nurses that are retiring early or leaving the profession altogether, and then all of these new hires coming in, it's a critical time for new people entering when we're so desperate for nurses and to replace those experienced nurses. Why is it, we're just as important, if not more, as PSWs, so why are we not being funded in the same way, especially following a pandemic where so many nurses were burnt out and decided to leave, even if they've only been a nurse for 5 years. I saw that many times. So I think that was my question that I wanted to ask, and it kind of went with what you were saying.
Let me be honest. It's absolutely something we're looking at. Recognizing that there are certain degrees, particularly when it comes to PSWs, but also nurses and a few other areas where there is a real need for people to step up. Why aren't we giving free tuition in those areas or massively incentivizing so it's pretty much free? Those are questions that we are actively looking at. It's something that we end up doing with provinces, right? Because there's a federal and a provincial element. But I can say it's a smart idea, and it's something we're really looking at. What's the question? Yeah.
Off of what she said about...
No, this is a conversation. It's supposed to flow. Sorry, first, what's your name?
My name's Addie. Off of what Olivia said about senior nurses burning out after 5 years or more, what I've noticed a lot, I work at the hospital when I can so that I can support myself, because consolidation, I know, will be very difficult to work during. We see charge nurses who only have 1 year of experience. So what we're seeing is, while it's excellent you're here meeting us, baby nurses, I think that the older nurses need a lot of support too, because they're who's going to be able to help us once we graduate from here. So I just am wondering if there's a plan to support nurses who are working and prevent their burnout. Like you said, there's a lack of resources, and I'm just wondering why is their pay capped at 1% a year? It's a massive issue. So we're coming into a field without very much mentorship. Like, we have Satwinder and we have Kim. We're really lucky to have them, but we need way more nurses with more than 1 year of experience.
Well, throughout the pandemic, I had a lot of opportunities to meet with, a lot of it over Zoom, a whole bunch of nurses and health professionals across the country who were, even as we were telling them they were all heroes, and that was, feels good, but it doesn't pay the rent, right? What they say, okay, it's great, but this really how you treat your heroes? The way they're getting burned out, the way they're overworked, the way they're feeling lack of respect from the institutions and the systems around is a real challenge. And we are seeing, and this is, we're seeing two things. We're seeing, first of all, a lot of folks who have tremendous experience, people who have been, working, who are into their later stages of their career with all the experience and everything, deciding, okay, you know what, that's enough. I'm going to take early retirement right now, and they've left. Now, a lot of them came back to help with the pandemic, but a lot of people are choosing to leave because they just can't anymore. Almost as concerning is a whole bunch of people who are entering the profession, wanting to help out, are not lasting more than 3 or 4 years, if even that, because it's like, oh my God, I got into this because I want to help people. This is the choice I've made. This is how I want to serve my community and build a life for myself. This is something I love doing. This is why you've chosen it. And they discover that they are unable to do as well as they want to do because they have to make impossible choices at home. Or because the resources aren't there, or because they're working, longer shifts and double and triple shifts on too regular a basis that doesn't allow them to have the quality level of interaction with people and support for people that is what drew them into the system. So there's no question that that is a big part of what's leading to all the challenges across our healthcare system, whether it's delays in surgeries because the staff is getting thinner and thinner and overworked, whether it's emergency rooms that are having to go on, sometimes open, sometimes not, because of lack of staff, whether it's all the pressures that we're facing across the board. That's a big piece of it. And that's where, actually stepping back, maybe this is a way to talk about the federal perspective on what we did this week. Canadians are rightly incredibly proud of our public universal healthcare system. It's one of those things that Canadians are always looking for ways to make sure that other people around the world know we're not just Americans who say we're different, and public healthcare is a huge part of it. No, you don't have to choose between a needed surgery or paying your mortgage or losing your house. That's not the reality in Canada. So it's a point of pride for Canada. Same time, over the past years, a whole bunch of people are seeing that our system is not working. It's not delivering for folks. And one of the things that we talked a lot about in terms of long-term care for seniors over the past years, but particularly during the pandemic, is quality of care depends on quality of conditions for people serving and offering that care. So working conditions lead directly to how well the outcomes are that you're going to get out of any healthcare system. So as we sort of looked at how the federal government can make sure that we're investing in health, understanding the provinces and territories deliver healthcare across the country, but do it in a way that's going to lead to real outcomes, we've done a couple of things. Well, we negotiated a couple of things, or we put an offer on the table around a couple of things on Tuesday. The first piece of it is better data and information. You need to, if you have someone coming into the emergency room, you should be able to know what tests they've had recently, what medications they're on, who their family doctor is, what specialists they've seen. Right now, we don't have a medical system that is able to do that properly across the country. Pharmacists in too many places are still trying to decode, doctors' handwritings on that. I mean, there has been movement made around that, but we need to make sure that not only are we doing that, but if people travel across provincial borders, if you're moving for work or moving for school, that your medical care can follow you or be linked to it. And we need to be able to see, as a country, what's going on across the country as well. I mean, in the beginning of the pandemic, we were dealing with faxes coming in from different parts of the country on writing and counting in different ways who was coming down with this new virus that nobody knew about. I mean, there was a real challenge around consolidation of data. So getting good data is, and there's a lot of question, are we putting conditions on the transfers to provinces or not? Well, provinces are in the business of delivering health care. What does the federal government know about how many nurses should be on a particular floor or how often you need to change a bedpan? That's not the federal government's job. That's what the provinces do and have expertise in. But we should be able to say, you've got to be able to show the outcomes. You've got to be able to show, people need to know what actually is working so we can compare it. Well, this district is doing much better than that, or this part of the country is doing better than that part of the country. What are they doing? Let's learn from it. Let's make sure we're all getting better. So collecting data is one of the things that we said we need to show results and outcomes on. But the other things we're looking at is 3 things that are core to our healthcare system. First of all, making sure that everyone in this country has access to a family doctor, primary care physician, or health team. That's super important because that's their gateway into healthcare. If your kid's got a tummy ache in the middle of the night, you want to be able to reach out to someone who knows your file, knows them, knows your family, knows things, and can direct you to the specialist or say, you should just take Tylenol and check their temperature or whatever it is that they need to do to get through. And too many people are just going to the emergency room because they can't access a family doctor. And that's a really inefficient way of running our system. So increasing the percentage of Canadians, hopefully to 100% eventually, who have access to a family doctor and a primary health team is huge. So that's something that is one of the indicators we're looking at in terms of negotiating with the provinces and making sure they're boosting that. Second one is mental health. Making sure that mental health supports and services are there in a timely fashion. It's great that over the past years people have seen a destigmatization of mental health. People are putting up their hands saying, yeah, I'm feeling really anxious or really depressed right now. I need help. I'm overwhelmed. This isn't normal. This isn't right. That's great. Because decades past, people wouldn't, you're weak. No, sick, not weak. You're facing something that people go through. So put up your hand and ask for help. That's great. But our system was designed around not many people being brave enough to put up their hands and ask for help. Now that everyone's doing it, we need to be able to respond to them. We don't have a system that is responsive. Hi, I'm in crisis. I'm asking for help. Great, we can get you an appointment in 6 months. Yeah, that's not going to work. Unfortunately, that happens, particularly with young people. If you can catch and support people struggling with mental health challenges in the ages of 15 to 25, you set them on a path of being able to be more successful and be more complete as a person and be able to deal with it for the rest of their lives. So that's an area. But one of the things that we're understanding, of course, is mental health isn't its own separate box. It's in everything we do. Having a good primary care physician who knows you, well, that's the first line of mental health as well. Being able to refer to the right specialists, understanding that you need a health team around you. Maybe it's just a psychologist. Maybe it's a psychiatrist. Maybe it's a psychoanalyst. Maybe it's just some sort of therapist that is more casual. Maybe there's a whole range of things that people need, and someone who knows you and can bring you through that, that's a better way of looking at it. But when we're talking mental health, we also need to talk about your mental health. The stress that everyone in the healthcare system is going through, and the stress that we're all as a society going through right now. And that's where building in resilience around mental health and looking at a more holistic approach to it than if you have a mental health clinic, we'll get you a bed in this institution and that will solve it. No, we need a much more of a continuum. And Carolyn Bennett, who's our Minister for Mental Health and Addictions, but was a family physician for many, many years, has been one of the hugest advocates of that. And that brings us to the third pillar, the third priority that we're working on with the provinces, which is support for healthcare workers. And that's something that we're absolutely focused on with them. And that making sure that you're not stretched so thin that your only choice is to leave this profession that you love and just hope people can figure it out, but you can't be part of it. Making sure you're getting proper support, making sure there's someone to take over that shift when you're at the end of it, making sure that the people who've been in the system long enough will stick around to be mentors and don't have to work as hard as the people coming in with more energy because they're there and there's nobody else around to do it. Increasing the numbers, increasing retention, increasing recruitment, increasing the ability to make sure that someone comes in with health skills. They're not going to spend a few years driving an Uber before they can save up enough to get the lessons to go and get their qualifications. Yes, we need to make sure that everyone working in our system is at the same level of quality so Canadians don't even wonder whether someone who was trained outside the country will be as good as someone who's trained in. Everyone is just as good. We need that, but we can do that a lot more efficiently. And these are the things that we're working on. So all this together that we've put on the table to the provinces are things that we think, particularly if we're measuring it and counting it and being transparent about all the outcomes, will set us up on a path for success. And that's what next steps. Okay, now we're going to get, thank you, Addie. Now, the pace is a lot slower. We'll now pick up the pace. I'll do 3 questions at a time because we got a good half hour to come. So we'll start with you.
Hi, my name is Toby, and I have a personal question. Taking you away from health and taking it into immigration. I need to ask a very specific question. What is the plan of Canada to bridge the gap between families? I'm an immigrant, and pre-COVID 2019, I had a surgery, a corrective surgery on my ankle. And I did apply for my mom to come visit me. And I tendered my doctor's letters. I worked prior to the surgery. My paycheck, I had money. Everything was just, I didn't hear a loan. So I did that twice. It was rejected. I wondered exactly what Canada's immigration requirement is. I had no idea. I was hurt. You talked about mental health. I was in a hospital for 7 months. My mental health went down, and there was no support. She was denied visa twice. And since then, up to now, I'm still by myself. I'm scared to even apply for her again. So what is the, and Canada is supposed to be a family-oriented nation, right? So what plan do you really have to bridge the gap? I have friends that have their spouses back in their country for 1 year, 2 years. They're waiting. Mothers are separated from their parents. Spouses are separated from each other. What is the plan to actually bring them together? How do you intend to bridge the gap between families, between loved ones? That's what I want to know.
Great question. I'll take a couple more questions and then we'll go. Go ahead.
Hi, my name is Hoon, and I'm also an international student, like not immigrant yet, but I want to mention about how cost of international students living. So for university, they asked me like 45 to 50K per year, and here I'm paying 20K. And to apply for the visa, I have to prove that I have enough money to come to Canada. So I prove 100K, and my friend got rejected, but because they think that she doesn't have enough money for 100K. But I don't know why, but thankfully I got, permission to come here. But you can, I heard that Canada have universal healthcare, but since I'm international, I cannot get none of that. So I went to clinic last week, and I want to have a meeting with the specialist, but they said like they cannot book a meeting with me because my insurance gonna be done at the end of April, but it's gonna take another 6 months to get the specialist. So like I'm calling my insurance every time, like before I go to clinic, like, can I go see a doctor? Is that covered, or should I have to pay $300? Like, I can, right? So I want to know what's the government plan, or there's anything that they're gonna do to support international student or like international worker to get like universal healthcare, and is there any way that we can get like scholarship or government funding, because we are exempted for the scholarship as well because we're international.
No, thank you, Sven. I'll take one last question. Yeah.
It's not as serious as
That's okay. That's okay. We all have to. These are.
I personally.
Sorry, what's your name?
Michael.
Michael.
I personally just want to know, like, after the whole pandemic is over, everybody put in as much work as they did. Just thinking about self-care, will we be able to get medals for all of the like self-care, like just to like say like we did this, for our children to see, our grandchildren to see that we worked through the pandemic. I really feel like medals money's good, obviously. Money, everything. Yeah. But this mission, you know, like recognition. Yeah, just medal, just to be like, hey, you know, here's a medal, you know, like, and a certificate, you know. I think to Merchant's gift card. Honestly, just to say, like, hey, you guys, like, even though it's not money involved, you're gonna get the money, but like, here's like a medal, just to be like, hey, thank you.
Listen, three great questions. First of all, on family reunification, that's been one of the strengths of Canada in terms of our immigration system for a long time, is that we have, and when people are choosing to come to different countries, you've got lots of different countries to choose to come to traditionally, Canada always did a good job of saying, no, if you come to Canada and you work, you're going to be able to bring over your family, your kids, your parents, your spouse. This is something that matters to us, and that's one of the reasons why I think Canada's been so successful in immigration over the past generations, is that we're not just bringing in workers to work for the rest of Canadians. We're bringing in families to build communities, to build a future, to create that strength. Over the past years, immigration has faced real challenges around the world, but also in Canada. There's been a movement against immigration in a lot of large countries. Canadians, fortunately for us and for the future of Canada, Canadians continue to be incredibly positive towards immigration. People know that people coming here create jobs, they build a future, they strengthen communities, they create success and growth in our economy, and add so much richness to our country in every different aspect. And that's something that Canadians deeply understand. We're one of the few countries in the world that doesn't have any explicitly anti-immigration party in our parliaments, right? I mean, there are people who have more enthusiasm versus less enthusiasm, but an anti-immigration party would have a hard time succeeding in Canada because so many Canadians understand how important that is. The pandemic has caused real challenges. We had to close our borders for a year, which layered on all sorts of things. I don't know if that intersected with the timing. And then coming out of the pandemic and having to pick things up as fast, get the backlog. We have now labor shortages, so we need more people to be coming in. There are crises going on around the world right now, bringing in people from Afghanistan, bringing in people from Ukraine, bringing in people from all around the world facing horrible, horrible situations, is putting stresses on our systems that, to be honest, the way the Canadian immigration system has always worked was, first of all, making sure that the numbers of people who came in would be able to succeed, that we'd be able to make sure that they would have homes and futures and jobs and those sorts of things, which is why when unemployment was higher in the past, the concern was not bringing in more people than we had jobs available potentially for them, because in places around the world where people have seen immigrants as coming to take away jobs, that's caused problems, and we need to protect the fact that Canadians are pro-immigration. So that's part of it. But sort of since the pandemic, we've seen a shift in things where we actually need more people to come in and do the jobs that we have. So we've increased our immigration numbers massively, and we're also trying to do a better job around temporary visas, visitor visas like for your mom. The system, I'll be honest, is still based around prove to me that you won't stay if you come, right? So if someone has a good job and a home and a house and a good status back home, then it's easier to convince them to come. But if your mom talked about how much she loves you and just wants to be there and you're there for her alone, that's scary for someone who's saying, well, I don't know, that sounds like your daughter's getting a good job, she might want to come and stay, and that would be a bad thing. See, that's what we have to shift. We have to stop saying, well, it would be a bad thing if these people were to choose to stay. It would be a good thing for your mom to choose to stay. However, one of the strengths of our immigration system is that it's fair and it has processes and rules for everyone. So, if it would seem unfair to Canadians and to all sorts of people if there was a back door for people who already had families here, but not for people who would want to build a family here, but weren't lucky in their timing to come over 10 years ago or 5 years ago or whatever it was. So these are all the things we're trying to balance, but I absolutely hear you. Your mom should have been able to come and see you. And we are working very, very hard. Our immigration minister, Sean Fraser, is working very, very hard on trying to shift the way we look at immigration and make sure that we're bringing people in. Because people are like, oh, there's a housing shortage, we shouldn't bring in too many people. There's a labor shortage in the construction industry in building houses. So as we bring in more people who can build houses, we will solve some of the housing shortage. So there's solutions in this. So part of it is shifting the attitudes. Part of it is also just improving our ability to process, using proper digital means and computer means. A lot of this is still done by paper. These are things we're trying to change, but in a post-pandemic world where people are not working the same way, there's challenges in this. So we're on it, and we'll keep on it, but please don't give up. And yes, the other thing I can recommend is talk to your local MP, because they can help out. Your local MP can help try to facilitate some of your access to immigration service. They can't change things. They don't make the decisions. They're made independently, but they can facilitate your pathway through that. Okay, Swin. I get this question all the time from international students, and it's a tough one because you seem really nice, and we're excited that you're here and learning, and it's going to be great that you have all these skills. But there's a difference between international students and Canadian students. Canadian students are here and are committed to Canada. Their parents paid taxes. They went through the Canadian system. Their families are part of it. We have to make sure that our focus as a country is on making sure that Canadians can get access to the schools and the skills that we need you to have. And even though the tuition here is about $2,000 a semester, I think, so $10,000 for your entire 2-year program, it costs a lot more than that to pay the salaries of the teachers and to build this and all that. So the government and the country rightly subsidizes massively our education system so that Canadians can access it. And when someone's coming in from outside, we have a system where we're allowed to say, okay, but you're going to have to pay more of the actual cost of your education, and the Canadian government and collected taxpayers are not going to subsidize to the same level what you're doing. But I hear you, and I do know that we do need to be encouraging international students to come in. We do need to have a role to play in training up for the shortage of doctors and nurses that exist around the world right now. So there are things that we are looking at that we can help with, but the priority has to remain making sure that we're giving proper support to people who are here, people who are Canadians or permanent residents who are making this commitment to Canada to make sure that they can have the health care and the supports that they need to do that. And not everyone internationally is going to be able to come to Canada who wants it. So we're saying, in I think a reasonable way that most Canadians agree with, well, let's make sure that the ones, because everyone wants to come, let's make sure that the ones who can pay and can get health insurance to access things are the ones we take, so we're not adding on the costs and burdens for Canadians. Not a great answer, but it's the way the system works, and I know it's not what you wanted to hear. Michael, I love that. But, it's not that far off from something that we already do. We think about how we talk about our troops. We think about how we respect and support those people who choose to make the potential ultimate sacrifice of serving their country through the military, of stepping up to fight, defend their country, and hopefully never have to, but be skilled to do that and say, I'm potentially giving up my life to serve the country in a very, very dangerous job that we need to do. And we've, as a, not just as a country, but as a civilization, have done a very good job of respecting and reflecting the service of people who do that. Well, you served over in Bosnia, here's the ribbon you get to wear for it. You served with incredible bravery during an extremely difficult time in Afghanistan, here's the medal you get. There's a recognition built in of that level of service and devotion to the country, of saying, I want to serve my country. Absolutely right. All of you, particularly choosing to do this after that first year of the pandemic, where you realized, oh my God, it is so important that we have good people serving in the healthcare, you should absolutely get that kind of recognition. You should absolutely do it. And yes, a medal and that kind of recognition is important, but medals are important because they are visible indicators of the respect that the community has for you. And the recognition of, you walk into a Tim Hortons in a Canadian Forces uniform, probably not paying for your coffee. Someone behind you in line or in front of you in line will say, and I'll pay for them. That's just the way we are. We need to get to a place where that level of respect, which we rightly give to people who choose to serve their country in the military, is given to those people who choose to serve on the front lines of other areas as well. And we think of what we went through in our healthcare systems. We think of what people had to do above and beyond and at risk to their own lives and to their own family. The healthcare workers who, during the first phase of the pandemic, where nobody really knew what this was and nobody really knew whether we'd ever get a vaccine for it, were worried, deathly worried about bringing it home to their families when they were on the front line dealing with this, when everyone else was hunkered down at home. That's real. And so the medals is a great idea, but what is underlying it, that respect and recognition for the work that you've done and will continue to do, because the world's not going to get easier over the coming years, is going to be incredibly important. And that's a shift in society that we have to build. And part of that is making sure that you're paid and resourced properly, that you're properly supported, that people see that as, one of the things we learned during the pandemic is our most vulnerable in society were being cared for by the next most vulnerable in society. We think of seniors in difficult situations in long-term care homes, and who were their personal support workers and nurses? Often vulnerable immigrant women making a very low amount of money and not really anything but incredibly vulnerable themselves. And that's something we have to shift as a society. It's going to require a rethink. And that's certainly part of what we're going to do. And I really appreciate you for bringing it up, Michael, and I appreciate the suggestion as well. Okay, we'll take you three. Go ahead, starting with you.
Hi, my name is Daisy. I'll bring us back to the financial aspect. There's a wage cap on nurses' wages. For RPNs, I think the highest we can earn is $31, no matter how long we work. But we're living in a society where we're going to the same shop as engineers, doctors, lawyers. We're buying the same things, same price of goods. I moved to Ottawa 2 years ago. I currently pay 1.3 with one-bedroom apartments. Right now, I can't get that. I can't even afford a two-bedroom apartment, even if I start working. Yeah, I have a daughter, so imagine living in such a condition. For you to get an apartment right now, it's going for like 1.617 for one-bedroom apartment. So how do we? I can't even calculate my salary. Like, okay, what we're going to housing, what we're going to food, what we're going to taking care of my child. And when I start working, they got CCB. We of course we drop because I'm earning something. So have more expenses, right? Secondly, childcare. For nurses, we work 2-4-7, right? And I've only heard about one licensed childcare that works 2-4-7 here. So meaning for those of us that don't have the luxury of having partners to stay at home, our partners have to choose not to work as of certain times, which is also going to reduce our fund to work for us to have child support. Some people don't have the luxury of having partners, especially as immigrants. Also, we don't have the luxury of having our family here to take our babies to. So we have to dedicate a part of our salary for child support at the time we're not working. At the time we're at the hospital, which of course a lot of childcare agencies are closed. So what's the plan for that? Nurses are not put into consideration in a lot of things because we're working 2/7. A lot of people are leaving the profession because of this work-life balance. People are leaving. I know someone that just came out and she started working. She left for tech because she can work from home. She's making more money. There's no wage cap. She gets increments every year. She gets to go on vacation. But as long as we can't do that, and we're treated like like it's a punishment. Like why do we have a wage cap? Why? Like what's the logic behind it? So that's my concern.
That's a great question, and it goes to the respect and the value. But I'll talk about that in a second. Yeah.
I'm Alicia, and I guess I just wanted to talk about how you mentioned that you think that nurses should be recognized, or you're trying to make a shift to in recognizing healthcare workers. And there's recently been, like, the budget was announced for healthcare, and part of that announcement included another wage increase for PSWs, but there was nothing about anything for nurses. Speaking to some senior nurses, from what I understand is a lot of them have left the industry because the PSWs got to keep that emergency additional wage that was offered to them, so now they're making just about the same amount as some of the nurses that are there. And I'm not denying that they didn't deserve that wage increase, they definitely did, but I do think that has a lot to do with a lot of the senior nurses that are leaving the industry. So I guess I want to know, is there plans to, with that new budget that was announced, to increase the wage for nurses?
Great question, Alicia. Thank you. And
Hi, I'm Robin. I'm in my last year of nursing, and I've been working this whole pandemic in group homes, and I work at 3 hospitals right now on top of my unpaid placement, and I'm still using my credit card to pay for groceries. So I'm just wondering, like, why are groceries so expensive? Like, I'm eating cookies from the hospital sometimes because I can't afford lunch, and I don't even get a break. I'm eating on the go. So it's just, I wonder why it's so hard.
listen, all three of you great questions on cost of living. Daisy, the answer is you shouldn't find it this expensive. And none of you should. You shouldn't be squeezed this way. This is not the way it should be, and it's the way it's been for a while at a base level. But the pandemic really brought that into focus, combined with the economic situation we're in right now. The pandemic caused challenges around supply chains that drove up the price of food and fuel and fertilizer and all sorts of other things. That is, of course, rippling down across society. And that's the inflation people are dealing with, which is a global phenomenon that Canada is doing better than most, and it's starting to come down. But, hearing that Canada is doing better than elsewhere doesn't help you pay your groceries, right? And that's it's cold comfort in that way. So we are. The other thing that we're challenged with is the war in Ukraine. There's all sorts of reasons for it, but people don't really care about the reasons. They just want to see how it's going to be fixed. A few things that we've done already, and you touched on a couple of them. First of all, you get a Canada Child Benefit for your daughter. That is a huge direct support that helps millions of Canadians. It has lifted hundreds of thousands of people out of poverty and made a huge difference. I mean, imagine without those hundreds of dollars tax-free a month coming in. That's the way it was before. That's making a really big difference. And even as you make more money, you're still going to be qualified for hundreds of dollars a month through the CCB, even as you make an income, because it only starts to phase out at around $150,000 a year. So there is that going to be support for there. On childcare, we just stepped up with signing with the provinces a couple of years ago now, and childcare fees have been cut in half. Which everybody knows, which is a really good thing. We're on our way to $10 childcare a day, which will make a huge difference. But part of those deals is around recognizing that the base model of childcare doesn't work for everyone. There needs to be more flexibility. You need after care, you need evening care, you need overnight care in some cases. That's something that the federal government doesn't directly handle. It's the provincial system of childcare, but it's something that is built into those deals that needs to happen, that needs to be pushed forward on, and there has to be availability for that. That's something that we recognize, because if we don't, you're going to get more people leaving a profession that we need people to stay in. And we know you chose nursing because that's what you want to do best. Ideally, you get to choose to do it and follow your passion and save people and heal people all your life. But if you can't raise your daughter, you're not going to stay in this profession. And that's on society to make sure that you're having the options to be able to do this job that is so incredibly important for us all. So these are things that we have to tweak to. The housing crisis people are in right now, rents being too high. This is something that we have made investments in over the past years. But housing prices continue to go up, availability continues to go down. We've actually recently are sending $4 billion directly to municipalities, bypassing the provinces, so that they can increase the number of housing starts. Even as we did that, inflation went up, interest rates are going up. We're having to put more money in just to keep the projects that we had on the table going. Immigration, bringing in more people to build those homes is going to be part of it as well. It's going to get better. We are seeing improvements in the housing market right now. But you're worried about rent right now and next year, and we have to make sure that we're trying to help you. We've created a Canada Housing Benefit that you'll be able to that you can apply to support in the rent. We've done things concretely like recognizing that not everyone can afford to send their kids to the dentist. And as of this past Christmas, we now have a dental program that means kids under 12 can go to the dentist for free or covered if they don't have insurance already. And by the end of this year, we're going to add kids under 18 and seniors and people living with disabilities. And then eventually, in the coming years, it'll be everyone under a certain income threshold that'll have access to dental care. That's not something that was part of our healthcare system before. Probably should have been, because we now know that mouth health is linked to everything else. So we're doing that. We doubled the GST rebate for 6 months, given the inflation crisis, and that's helping too. There's all these different things we're doing, but there's more to do. The good news is the money we're putting into the provinces is money that will reassure provinces that there is a long-term support there to hire and to change conditions. During the pandemic, what the federal government did is we flushed massive amounts of money into the system to support individuals, families, to support small businesses, to support people who could stay at home, to support provinces and the healthcare system. We spent about $72 billion over the 2 years of the acute phase of the pandemic on health expenses, on top of the 45 billion a year that we send to the provinces for health. So that was a massive, it was free vaccines, it was masks, it was boosts to the healthcare systems, direct transfers, no strings attached to the provinces so they could support their healthcare systems. 8 out of 10 of the supports on the pandemic came from the federal government, which means now that we're out of the pandemic, the provinces are mostly in surplus situations right now. They have lots of money. The federal government took on a lot of debt so that the provinces didn't have to, so that Canadians didn't have to. And it worked. We got through the pandemic better than just about any other country comparable to us. And our economy came back quicker than just about any other country comparable to us, way quicker than the United States, where the economy is doing reasonably well. We got back quicker because we had those supports, because so many small businesses didn't shut down. Like, we made it through well because of what the federal government did, and mostly because of what Canadians did in following science and listening to data and listening to the health professionals, getting vaccinated to a higher degree than just about anyone else. That was a really good thing. But now it's time also, with giving that reassurance of the long-term money for the provinces that we are offering over the next 10 years and into the future. We also increased the Canada Health Transfer indefinitely, recognizing that the federal government is really strained in its finances. The provinces are largely in surplus situations. They can now lean in on improving the conditions of learning, the conditions of work, the conditions of pay that they control for nurses and for healthcare professionals. Whether they do or not, because the federal government doesn't get to tell the provinces what to do. We're not sort of the boss of the provinces who are the boss of the municipality. Yes, the provinces are the bosses of the municipalities, but the federal government and the provincial governments are partners in running this country. We don't get to dictate. So the choices people make right now, there is an awful lot of more conservative governments at the provincial level. Typically, conservative governments tend to lean a little less towards a universal public system, tend to look at a little more privatization, whereas the federal government will always stand up for the principles of the Canada Health Act and make sure that our public universal system is strong. The negotiations that the nurses' unions do with the provinces, that happens with the provinces, not with the federal government. So these are things that are really important but have to be thought about, both as those negotiations are going on, but also as people vote at the provincial level and the federal level what kinds of investments are going to be made in those things. Alicia, Robin, yes, we did step up on PSWs, but the work's not done yet. They're not yet making the $25 an hour that we committed to. We put in, and we're putting forward about a $1.7 billion to help get part of the way, but the provinces have to step up on part of that as well. Not all of them are doing it, but there is no reason for people who are working 3 jobs like you to not be able to pay for your groceries. And yes, groceries are more expensive now, but nobody who is working as hard as you are in a country as wealthy as Canada should be having to steal cookies or borrow cookies from work to get through. That's a sign of a system that doesn't work. It doesn't work for the patients that you're working 3 different jobs to try and give your best to, because at one point you're just not going to be able to give them the quality of care that they have every right to deserve. That's not on you. That's on the system that is stretching you too thin. And the fact that you are showing the strength and the determination to go through is hugely inspiring. But we shouldn't have a system that depends on people being extraordinary and resilient and willing to go above and beyond to make the system work. So it's a perfect example of why we need to be doing a lot better job in supporting you professionally, making sure that you can offer the best quality of care to the people that are out there, because quality of care depends on quality of working conditions, and you're not having that now. Like I say, it is really tough right now. It's going to get better. The inflation is already starting to come down. Interest rates should flatten out. The people have jobs. Our employment level is strong in this country. The fundamentals and where we're going in terms of the advantages Canada has, in terms of natural resources, in terms of the minerals that the world needs for the green energy transition, in terms of extraordinary livable cities with incredibly diverse populations that are ready to solve all the big challenges and create an incredible future and present for everyone. Canada has the kinds of advantages that countries around the world would be desperate for. but we're going through a really difficult time right now, not just as a country, as a world. And we're going to have to do a better job of being there for each other to support each other through these times. And that's why, as a federal government, we're going to continue to step up, but why also we're going to be pushing on provinces and municipalities to do their part as well, to be investing in affordable housing, to be investing in and to be negotiating in good faith at the bargaining table with frontline workers to make sure that you can actually, start and support a family on the salaries you're making. We're not there yet. I have a lot of optimism. We are going to be getting there, and I'm praying that you hang in there, as tough as it is right now, because man, oh man, do we need you? Do we need all of you to be doing what you've chosen to do? But we need to do a much better job of recognizing that. It's, to a certain extent, easy for me to be here talking about it because the federal government doesn't have direct responsibility over your pay or things like that. But we do have a role to play, and we're trying to do our very best to play it, and we'll continue to try and push our partners across the country to be at the level they need to be as well. Thank you, Robin.
Mr. Prime Minister, thank you so much for coming. We
Just went so fast. I'm sorry.
as faculty, we're so proud to pass on our skills to our students. And I treat my students like you're going to be my future peers, right? You're going to be taking care of us. You'll be tougher than I'll be, nice, much nicer. But we want you, to have those skills. But we also, as you can see, everybody wants to support you financially and every way we can. So thank you for listening to all the questions and explaining as well as you could.
No.
Thank you.